chairman of APC, Alhaji Ganiu Oluwagbemiga Onotoye. ALAGBADO.
I want to wholeheartedly appreciate Ambassador Shinozawa Takayuki, the ambassador of Japan to Nigeria, and the Street to School initiative for this noble gesture. This will be the second help project facilitated by this NGO in this LCDA. Please let us give. You will recall that in September last year, a similar project of this nature was carried out by the Japanese embassy, which has been largely beneficial to our people. This project again will in no doubt improve healthcare service rendered in this facility and the LCD at large. The medical equipment and office furniture provided will aid efficiency and speed in service delivery to the public. Mr. Ambassador, sir, you can be rest assured that this facility will be put to optimal use and will be well maintained. At this juncture, let me urge our people to desist from acts that can render public property useless. This project is ours and should be well utilized. I wish you all a Merry Christmas and New Year in advance. God bless you all.
1, 2, 3. Thank you.
Yes, but it's only yes, we have to. Yes, but it's only Japanese. It's your product. Yes, so these are the things that we worked on. This is our story.
Then your President, Excellency Buhari, visited Japan and meet with the Prime Minister. Then he, during his summit meeting, he committing to that healthcare contribution to the Nigeria. So this is one of our contribution to the Nigeria for developing the healthcare.
It is always a good thing to see partners recognize our weak areas and contribute to them. The most important thing is for the people to realize that this is not like a crutch for them to use to move forward, but more like a mobilizer for them to utilize. The primary health care system, the MOH, the local government must mobilize and utilize the facilities provided efficiently and must even help to contribute, because it's not all up to the partner all the time. Now the foundation has been laid, we must as a community come together and put our little efforts to make it more functional and accessible and affordable for the people of the community.
Street to School is actually education centric. We support more of children that want to write common entrance exam, they don't have money, we pay their bills. Children that drop out of primary school because they don't have money, we put them back in school, we pay all their bills. Young people that want to write NECO, GC, JAM, and they don't have the resource, we also provide and we sponsor them. So we've been doing more of education for 10 years until we started a free school, a tuition-free school in 2015. So in this particular community, we realized that access to primary health care was poor, and also there were no government-owned school within that community. So as an organization, what we did was to set up a school to meet the educational needs of the kids. Then for the health care, because there are times children will come to school sick, and their parents will still release them to come to school. So what we do, there are times to send these kids to hospitals, we paid for their drugs, for their treatment, because we realized that the parents actually send them to school because they don't have the resource, they don't have the money, the funding. So we have to take all of this responsibility. So it's more than just keeping the children, having the children in school. We are responsible for a whole lot. We have children that don't eat to school. We have to start feeding them, buying food and all of this. So for us coming into the health space, we saw that there was a need. When children fall sick, when they come to school, we try to help them, and the next time we don't see them, and we realize that there had been lots of self-medications, taking ALAGBADO, taking all this traditional, medicine, and we lost a child in 2017, a 7-year-old girl. She came to the office, she came to school that day, she had, high temperature, and the first question we usually ask them when we notice that is, have you eaten? When I asked her around 9 o'clock, she said she hasn't taken her breakfast. I knew maybe that could trigger the headache and are not feeling fine. So we had to go and get her food. She ate in my office. She even rested. She didn't join the others in school. And you can imagine, like 2-3 weeks later, this same girl died. We got to know that because the parents couldn't afford to take her to hospitals, private hospital or the public ones around, she had to subject her to taking herbs, and then the legs and the stomach of the 7-year-old girl started getting swollen, and eventually she died in a church. So that was and that wasn't the only case that we had. We had a mother of a child sick, and we tried to help. We have a medical practitioner that works with us. She went to the house, but eventually too, she lost her life. She died. So 2 sponsored children that are losing their parents in the same community and the child dying, we felt we could do something. So that was how we went around, we wrote letters, we disturbed everyone that we could disturb. We were not going to keep quiet. We were going to raise our voice for these children. So eventually we got the Japan embassy coming to intervene in the community, Kola community, and they helped. They renovated the entire structure and provided the medical equipment necessary. So here is the second project that is being sponsored by the Japan embassy, which we are very thankful for, because with it here now, children will have access to quality health care. They won't have to think about the journey to go to the nearest, public hospital, but now there's something that is quality within their community. So children wouldn't have to stay out of school. At least they know there's somewhere they could go to get a drug and to get proper treatment. As a Nigerian, the building of this nation it's more of a collective responsibility. It's not a one-man affair. It's not the president's affair. It's everybody. There's a part everyone got to play. So we need to play this part right. If we want a Nigeria of our dream, everyone must act. We must come out and do what is expected of us. I'm so passionate about rural communities where accessibility is so poor, where people are dying and nobody keeps record, where people don't have access to these basic, amenities. So those are the areas I'm passionate about. So for our primary health care board, we will appreciate if more focus will be given to PHCs that are in rural communities, so that we have something very functional and not partly functional, a place where people will be glad to go and they will attend to them well.
We are really grateful for this kind of environment and for conducive environment for the people, for the growing of children. We really say thank you to the Japanese embassy.
Appreciate the government for making them to even remember this place, because it's not easy. This is a rural area, and they remembered us to even do this for us. We really appreciate, and we are happy for that.
In the past, our mothers, nursing mothers, they will come to clinic with their large number. Most of them will be standing up while giving them health talks. But we thank God now they have provided those small seats. They can sit comfortably during a health talk and listen to us. So we are very grateful. We now have a laboratory. We have a equipped laboratory now, which was not in place before. Now we have a big pharmacy, and we are expecting doctors to be posted here.